Which is better, a Medicare supplement policy or a Medicare Advantage plan? I think the better way to phrase that question is which is better for you and your circumstances. So what I'm going to do right now is I'm going to talk about the two different paths you can take when you are on Medicare. And then hopefully by listening to these similarities and the differences between the programs, you can figure out which is better for you. We're going to start by talking about how the programs are similar. So when you decide it's time to enroll in Medicare, you're going to start with the Social Security Administration, and you're going to enroll in Medicare Part A, which is your hospital coverage, and Medicare Part B, which is everything outside of the hospitals, doctors, labs, etc. Medicare Part A is typically a $0 premium. It's because of the FICA tax that's been coming out of your paycheck all these years. And Medicare Part B, most people pay $185 a month in 2025, although some people have something called IRMA, where if your income is above a certain threshold, you're gonna pay more than the standard $185. Now that you've signed up for Medicare, your work has just begun. Now you're at that fork in the road. Are you going to go with Original Medicare or Medicare Advantage? So now we're going to start to talk about how the programs are different. If you go with Original Medicare, your insurance is managed by the federal government. If instead you go with Medicare Part C or a Medicare Advantage plan, you now have private managed care. Now, a lot of people think that if they choose Medicare Part C, they don't have to pay for Medicare Part B, but that is incorrect. Whether you're in this column or this column, the Medicare Part B premium is going to be yours to pay. We're going to talk about the cost first. So if you stick with the federal government program, Medicare is not designed to cover every dollar. So for example, if you have a Medicare Part B claim, it's designed to cover 80% of it, and there's 20% remaining. There's different deductibles, etc. So what most people do, if they stick with Original Medicare, is they get a Medicare supplement policy. Typically, I recommend Plan G or N. What the premium is going to be for that depends on your age, your sex, where you live. Do you get a couples discount? Are you a smoker, etc. So when you look at Original Medicare, because you get this Medicare supplement policy and you pay for it, whether you go to the doctor or you do not, I would refer to this as you pay up front. But basically what you're doing is you are managing your monthly costs. You know exactly what you're going to be spending, and you're covering most of the dollar gaps of a Medicare approved claim. You also are going to need to enroll in a Part D plan, prescription drug coverage. Those plans can have a monthly premium. They'll have copays. The max you can spend in 2025 on copays is $2,000. That cap applies to drugs that are within your drug plan's formulary. If you're taking a drug outside of your drug plan's formulary, then you could spend more than $2,000. Now, no, if you are in Medicare Advantage, you do not get a Medicare supplement policy. And you do get Medicare Part D, but it's going to be built into your Medicare Advantage plan. So how does Medicare Advantage plan work from a monthly cost? Typically, it's a $0 premium. But in exchange for that $0 premium, you're saying, hey, I'll cost share, I'll pay copays, coinsurance, deductibles, etc. as I go. And you have what's called a max out of pocket that you could spend. Maybe a plan says it's $4,000, $5,000, $6,000, whatever it is. But the way that you spend it, it's not like a deductible. It's small payments each time you use a service. So that's why I refer to this as pay as you go. So with this max out of pocket, however they define it, that is not including your drug copays. That is on top of the max out of pocket defined by your plan. And each plan is going to define the copays. For example, one plan may say every night you're in the hospital, you're going to spend $250. Another plan may say it's $395. So you have to look to the specifics of the plan. The next difference between Original Medicare and Medicare Advantage is your reach for doctors. In Original Medicare, you can see any doctor across the United States who is contracted with Medicare. With Medicare Advantage, you're going to have an HMO or a PPO network. It could be local, it could be regional, it could be national. So you want to pay attention to when you're selecting a plan to make sure that your doctor is in that network. The next difference between original Medicare and Medicare Advantage is a concept called prior authorization. In original Medicare, your doctor determines your medically necessary care. The only time you really see prior authorization would be with durable medical equipment and maybe some other limited circumstances. But the point is, if your doctor recommends an MRI or skilled nursing care, you go. There's nobody else determining whether or not you're going. Of course, your doctor has to code it right, the bill, to show why it was medically necessary. But like I said, you go. When it comes to a Medicare Advantage plan, same recommendation by your doctor before you can get that MRI or the skilled nursing care. The managed care company has to agree with your doctor. Now, that's not on every single thing your doctor recommends, but it is on a lot of the more expensive services. The last big difference I want to talk to you about are the perks. So when you see a million commercials, especially during the Medicare AEP in the fall, talking about dental, vision, hearing, the gym, over-the-counter benefit, flex cards, etc., that is Medicare Advantage. Original Medicare does not offer those perks as part of their services. So a lot of people get really excited about these perks. Perks, of course, are a good thing, but they're only a good thing if this system meets your healthcare needs. So I always say to people, figure out your path. If your path is Medicare Advantage, then celebrate the perks, but first choose based on your healthcare needs, your doctors, your drugs, etc. So maybe you're waiting for me to say which is better with the question I started with, and then I repose it as which is better for you. So with my clients, I go through this exercise. We talk about lots of things to figure out which is the right path. I tend to land over here more, but that doesn't mean that I don't believe that this could be a good fit for somebody. So this is your starting place, and then you got to get into the details and really figure out what's right for you.